Today I'm going to give you a really quick introduction to your pelvic floor because we've learned how to incorporate that diaphragmatic breath. We're eventually going to get into that full core breathing belly pump, but the second step in this combo is learning how to properly activate your pelvic floor. And I just want to preface this all by saying I'm not a pelvic floor PT or OT, and I always recommend that you seek one out and you have an appointment during pregnancy and postpartum just to get a lay of the land, see what's going on in your pelvic floor, and I promise you the experience is mind-blowing. But here we're gonna talk about how to properly activate your pelvic floor, or Kegel. So Kegels get a bad rep, and it's because most of us are not taught to Kegel properly. We're usually told the cue, stop the flow of urine, in order to do a Kegel. And that's only this front section of your pelvic floor. In order to do a proper pelvic floor activation, you want to think about all of these muscles that line the bowl of the pelvis. So I'm going to take you through 3 areas of the pelvic floor for you to check in, practice an activation, practice a release, get a sense of which areas of the pelvic floor feel the strongest, what feels a little weak, and that's going to give you some better direction when you head into those pelvic floor activations to know exactly where you should be cueing, activating to do a proper Kegel or pelvic floor lift. So first step is to use that cue that we've been taught, stop the flow of urine. So if you just think of that front section of the pelvic floor, I want you to exhale, imagine that you're stopping the flow of urine, and as you inhale, release that muscle activation, put it down. Good. The important thing about a pelvic floor activation or a Kegel is to make sure that you're going through that full range of muscle contraction and release. So it's not just turning that muscle on and then pulsing it on, even tighter. You have to make sure that you turn it on and then you turn it off. The on happens on your exhale. That's that pelvic floor lift. And the off happens on your inhale. Now what we just learned about the diaphragm's taking this motion in the body. Your pelvic floor is a mirror, or they're a bookend. So as you breathe in, that diaphragm moves down, your pelvic floor relaxes. As you breathe out, your pelvic floor lifts, the diaphragm pushes the air back out of the body again. So sticking with that front section, stopping the flow of urine, exhale. Inhale, feel it release. Now you're just gonna take a mental note on, were you able to feel on and off? Does it feel strong? Does it feel weak? Then you're gonna travel to the back end, the muscles around the anus. So I like to use the cue to imagine that you're stopping yourself from passing gas. You're standing in a crowded elevator, you can't pass gas, and I don't want you to clench your glutes or tuck your pelvis. So try to keep that nice neutral alignment in the spine and the pelvis. As you breathe out, stop yourself from passing gas. As you breathe in, try to turn that muscle activation off. Now this one gets a little harder for some people because they like to go into that back end pelvic floor activation with a tuck, and that's just a sign that those muscles are a little weak and the rest of your body's trying to compensate to get them turned on. So see if you can think of closing the anus first and then drawing up to the center of the body. And then as you inhale, put it down and open. Take that one more time. Exhale, close and lift. Stop yourself from passing gas. Inhale, release. Then you're gonna go back and think about that front section that you did. Does that back section feel stronger, weaker, or about the same? Middle section. So the section through the vagina, I want you to think of closing and lifting on your exhale, and then releasing and relaxing on your inhale. So take that again. Exhale, close and lift. Right up through the center. Inhale and release. Take that one more time. Exhale, close and lift. Inhale, release. Now think about that front section, think about that back section. Compare what feels the strongest, what feels the weakest. That's where you're going to initiate your cueing. So if you felt a little weaker in the back end, you're still gonna try to take that full pelvic floor activation as you breathe out, but you're gonna put your brain in the back end first to see if we can get those back muscles to fire and start to coordinate in combination with all of those sections. So let's put it all together. You're gonna take front, middle, and back. You can also think of the 4 bony points of the pelvis: pubic bone at the front, tailbone at the back, sits bones, side to side. And if you have those 4 corners or that diamond, you're gonna take that diamond shape and you're gonna draw all 4 points together as you breathe out, close and lift. Inhale, take those points back down, spread them apart, inhale and release. One more time, exhale, close and lift. Inhale and release. Great. So this is just a tip of the iceberg when it comes to a pelvic floor activation. And as I said before, check out a pelvic floor PT or OT to get a more in-depth look and understanding about what's happening in your pelvic floor. But this is a great start. And now that you've got that pelvic floor turned on, we're gonna move on to your full core breathing belly pump.